You know, typically there's no medication that you can't take while you're on warfarin. You just need to monitor. So there are medications that, based on the metabolism of the drug or just the way the blood travels in the body, will cause an interaction with warfarin. So it's just a matter of keeping a close eye. Some drugs that have a documented effect, you may want to cut back the dose if the patient is starting, just knowing that there is going to be an interaction, so that way you could avoid that INR from getting high in the first place, rather than treating it after it's high, which is not really ideal. So those are the things that we look out for. And we actually use an software system that basically has a drug interaction checker. So anytime a patient starts a new medication, or if they stop a medication that they've been on, we're able to see if that could have a potential effect on their INR.
So that would be important for people to understand if they start a med or stop a med,
yes,
to let you know.
Yes, definitely.
And certainly their doctor should let you know also,
yes,
right?
Yes, definitely.
Okay. And other than the bleeding and the bruising, there's nothing in particular that people should know might happen?
Not really. Some patients anecdotally, you know, say that sometimes they feel cold when they're on warfarin. Yeah, it's just something that we hear a lot. I don't know if warfarin really causes it. It's not really a documented interaction, but it is something that we hear. I don't know if it's more, you know, psychological. Is it because the blood is thinner and they think they're colder? I honestly don't know.
It doesn't really thin the blood. I mean, we should clarify that.
Yes, yes.
It just changes your coagulation
Exactly.
speed.
So I don't know if part of
people
it
should know that it's not thinning your blood.
Yes.
I know I hear from people who spend a lot of time in Florida that their blood got thinner.
Yes.
And they can't stand the cold.
Exactly.
So there's a lot of this mythology going on.
Exactly, and I think that's part of where that comes from.
Okay.
So no, other than that, there's really, you know, it's just making sure that the INR is at the therapeutic range to minimize any potential risk of bleeding.
Okay. So a patient gets referred to the AMS service and they come in for their first visit. What might happen at that visit?
So at that first visit, they'll meet initially with the pharmacist to, again, review their medications, to go over their medical history, make sure that everything that's been provided by the primary care physician is accurate in terms of their medical history. We'll do our education regarding the warfarin booklet, make sure that they know about the medications, as well as, you know, that especially for patients that have been on it for a while, it's nice to have a refresher. You know, the patients that we've seen thus far have been patients that have been on Coumadin for many years, and it's interesting. You would think that those patients would be kind of resistant to education because they've been on it for years. They know.
Oh, they know.
You'd be surprised how many questions we got from those patients. So I think it's nice.
Maybe no one ever answered them before.
That's true. That's true. And you know, now they have somebody that's taking the time to listen, you know, to their concerns. So it's nice, and we have that warfarin booklet that the patient can take home and refer to at any time.
And they have some lab work done that first visit?
Yes, they can. Yeah, we can make arrangements for them to have their blood drawn there at the lab. We have a lab right in the same suite as us in Reading. We'll send what's called a standing order to the laboratory, and that standing order actually will let them go to any Hallmark Health laboratory. So it doesn't, so it doesn't have to be just that one. They can, and it's good for a year. So they could have it done at Reading during the visit, and then after that they can go to Melrose. You know, they have a lot of flexibility where they can go to get the blood done. So yeah, so I think, you know, for the most part, patients have been very happy with our service.
Yes,
so.
And somebody who's really an expert to talk to, because you know, that always makes people feel better when there's somebody who really knows this medication and how it works.
And it's nice too because you know, we're aware of all the different things that can affect diet, can affect, you know, your levels as well, and we're able to make like for example, if you eat too many green leafy vegetables or your diet really is inconsistent in terms of the vitamin K intake that you take. Vitamin K is in a lot of green vegetables. A lot of patients have been counseled that they should not eat any green vegetables, which is not true.
That would be terrible.
Yeah, and some patients actually do make it kind of
Well,
their way
I
of
heard
life.
people say they can't have spinach.
Yeah.
Somehow got focused on one.
Yeah. So it's just kind of educating patients that you know, that they can. There's a lot of nutritional value in those other types of foods. It's just a matter of keeping an eye on the INR, adjusting the dosage as you need to, giving them resources so they can, you know, the warfarin booklet that we provide them gives them the amount of vitamin K in those common foods, so they can basically see what the difference is between a spinach or a lettuce, you know what I mean? And also we're able to, if a patient's really struggling with their diet, we're able to make nutritional consults so they can meet with a dietitian. Yeah, so we can make those arrangements as well, because the diet component too is pretty important with this medication. So basically we really focus on the warfarin management, the INR, and basically look at, what other disciplines can we incorporate, to help the patient get the maximum effect from their medication.
Okay. And is this something that's covered by insurance? Since it's a doctor's referral, it
Yeah,
probably is.
so basically the initial visit, we'll have all patients come in for an initial visit to meet again with the pharmacist and with the medical director. That would be subject to whatever copay your insurance dictates. Medicare, we're covered by Medicare. So basically it would just be like going to your regular physician's office. If a referral is necessary, we would take care of that before you come in for the visit. After that, for the most part, patients will be phone managed. And what I mean by phone managed is that they would go to the lab to get their INR tested, and we would follow up with the results and the warfarin dose by telephone. So the patient
you might change the dose, but over the phone.
Exactly. So the patient doesn't have to come in for another visit. Those there's no charge for those consultations.
Okay.
And the patient can call us anytime with any questions they have about their medication.
Good. Okay. So what kinds of patients might be using this service?
So for the most part, like I said, warfarin's the biggest medication that we monitor. So patients that commonly are on warfarin are patients that have heart valve replacements. So somebody that might have a mechanical valve would be on warfarin. A patient that has arrhythmias, like atrial fibrillation is a common one. Any patients that have orthopedic surgery, so sometimes they'll get treated with warfarin for a few weeks. Yep. Anybody that's ever had a blood clot, either in their leg or that's traveled to their lung, what's called a DVT or a PE, would be patients that would be on warfarin. And so basically, our service is open to anybody that has a Hallmark affiliated physician, and that's on warfarin. So we pretty much take anybody that's referred to us.
And family members can come and get education
of course.
too?
Oh, we really encourage that, actually. We have a lot of elderly patients that have either their son or daughter that helps them with their medication, and we definitely encourage them to come to that initial consult.
What if somebody can't get there, like they're physically unable to
Yep, so we actually do make exceptions for those people. Obviously, you're not going to drag somebody that's homebound,
or who's handicapped,
or handicapped, or it's really a physical. So basically, the way we handle those type of referrals is that we run them by our medical director. So he reviews those patients' records to make sure that he feels comfortable taking them on as a patient. And for the most part, there really wouldn't be a reason why you wouldn't. And then we just strictly monitor them by phone, so they wouldn't have to come in for their initial visit.
For the initial visit, but what this is constant? Do they have home visiting people?
So a lot of them use a home draw facility called Faulkner Home Draws. They work a lot with the local hospitals, and we can make arrangements with them with VNA services. So yes, it would work the same way.
Somebody can come in the home, take the blood, withdraw some blood, take it in, get it tested.
And then send it to us, and then, and then we would contact the patient by phone.
Okay, well, that's good service.
Yeah. And we actually have quite a few patients that we manage that way as well. So.
And you, patients from all towns around here can use this service?
Yep, so basically our only requirement is that they have a Hallmark Health physician. Yep. Okay. But yeah, anybody from any city is eligible.
Okay. What are some of the common questions or concerns that patients bring in when they, I imagine some of them have quite some fear about it, and other people just have.
Well, I think we kind of talked about that. A lot of patients ask, why do I need the service? My primary care physician's been doing it for this many years. So again, I would just want to say what I mentioned earlier in our
that we have better results.
That we have better results.
Decided.
And not that they're doing anything wrong. It's just they don't have the time or the resources. They're dealing with a lot of patients, a lot of different issues. A lot of times, it takes a while to arrange for these home draw services. It takes a while to track down results, and they just don't have the ability to do that or the resources. So we really kind of take that off their plate, so they're really able to focus on. And they're still involved. I really want to emphasize that they're still involved. We're kind of just doing it, you know, more of the day-to-day stuff for them. But they're still actively involved in the anticoagulation management of the patient. They're getting all our documentation.